Hello, I'm Dr. Beth Colby from Talk Mental Health and I work as a psychiatrist in London. Alien hand syndrome is a very rare neurological condition characterised by involuntary movements of the non-dominant limb, such as the left hand. However, less commonly, the leg is involved. The limb does not have any motor problems and appears to be under the control of the person and being moved intentionally, but this is not the case. It appears as though the hand has a mind of its own and the person may not feel that the limb belongs to them. However, the person does not deny limb ownership, which occurs in other neurological conditions. Symptoms may include the hand levitating on its own, compulsively doing a task such as picking up an object that has been put away, or touching the person's face. It may undo what the other hand has just done, so it may, for instance, open a cupboard door that the other hand has just closed, or undo a button that the other hand has just done up. The symptoms that a person with alien hand syndrome experience depends on which specific region of the brain is affected. Where the frontal region of the brain is involved, the person experiences groping or grasping of the hand. People where the corpus callosum, which joins the right and left hemispheres of the brain together, is involved, have agnostic dyspraxia. In this condition, a person may respond to a command but use the opposite limb. So, for instance, if a person is asked to put their right hand on their head, they may put their left hand on their head. The third area of the brain that alien hand syndrome is involved in is the posterior region of the brain. People will experience their brain not recognising the limb as theirs, and they may have impaired motor control of that limb. Alien hand syndrome may indicate a serious underlying disease, such as neurodegenerative disease, Alzheimer's or Parkinson's disease, for instance, a brain tumour, trauma to the brain, a brain aneurysm, or surgery separating the right and left hemispheres of the brain. Alien hand syndrome is sometimes called Dr. Strangelove syndrome, from the 1964 film where Dr. Strangelove suffered from alien hand syndrome. It may also be termed Strangelovian hand or anarchic hand. It is difficult to diagnose alien hand syndrome as the symptoms may be caused by a psychiatric or behavioural disorder, which is far more common than the neurological condition alien hand syndrome. There are no diagnostic criteria, but if a person experiences their limb feeling foreign to them and complex involuntary movements that do not fit with the symptoms of a different movement disorder, then alien hand syndrome is diagnosed. There is no cure for alien hand syndrome, and treatments are in the experimental stage. If the syndrome is caused by a condition that may resolve or recover, such as a stroke, then the symptom will go away. However, it is less likely that a person will recover from alien hand syndrome if they have a neurodegenerative disease. Some treatment options used include muscle control therapies such as botulinum toxin, Botox, or neuromuscular blocking agents. However, behavioural techniques appear to work better than medication. Some people try to stop their alien hand from moving by sitting on it. They may also put an object into the alien hand to stop it from doing tasks. The symptoms of alien hand syndrome may be helped by a physiotherapist, psychologist, or occupational therapist. Thank you for listening. Bye for now.